This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Asthma affects roughly 10.7 million Filipinos.
Well, if you look at the incidence of asthma, worldwide we have more than 230 million patients of asthma all over the world. And it's a common cause of hospitalizations, not only in children but also in adults. It's the third leading cause of hospitalizations worldwide, even here in the Philippines. Asthma is basically it's an inflammation of the airways. What happens is that there's bronchial reactivity, meaning yung daanan ng hangin mabilis lumiit, malikot siya, and at the same time it produces lots of phlegm.
While it is not always apparent on what causes asthma to occur, the most common trigger usually comes from physical activities, or what is referred to as exercise-induced asthma.
And also it can be triggered by food. The most common are seafoods, so especially shrimp, crabs, eggs can trigger, especially the white of the egg, peanuts, and then the skin of the chicken can trigger asthma. Chocolates, cold temperatures, cold drinks can trigger, processed foods, house dust mites. So these are the different triggers that can push a patient into developing an asthmatic attack.
If not treated, asthma can permanently narrow the airways and can easily translate to exposed nerve endings that will later on be even more susceptible to asthma triggers. What should you do when asthma attacks? What are some possible triggers and how can you avoid them? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Kristan Cabanilla, a pediatric pulmonologist from the Philippine Children's Medical Center and a fellow of the Pediatric Society and the Philippine Academy of Pediatric Pulmonologists. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Kristan.
Good evening. Magandang gabi po sa inyong lahat.
Welcome to MedTalk.
Salamat po. It's my pleasure.
And it's our pleasure to learn more about asthma from you, Doctor. So what is asthma and what causes asthma?
Well, ang asthma po ay isang napaka-interesting disease by itself. Katulad doon ng sabi sa primer, lumiliit po yung daanan ng hangin, kaya nahihirapang pumasok at lumabas yung hangin. It is as simple as that. But ang concern lang ho minsan ho nagkakaroon ng triggers na pagka sobra ang liit ng daanan ng hangin, o nahihirapan tayong ipasok yung daanan ng hangin, talagang nahihirapang huminga ang isang tao, bata o matanda.
So pag nahihirapan huminga ang isang tao, it hampers their life, no?
Siyempre
their health, di ba?
Kasi yung oxygen, nahihirapan pumasok. Oxygen is quite vital. Day-to-day life natin, siya ho kailangan ng isang tao. So kung konti ang oxygen na pumapasok, at meron hong byproduct ng metabolism na tinatawag nating carbon dioxide. At kung hindi ho yun makalabas sa ating sistema, malalason ho tayo. That in itself, in a nutshell, is asthma.
And how does one develop asthma? What are the signs of one who has asthma or has developed asthma?
Ang pananaw ho ngayon, ang asthma is basically a genetic disease. Ito ho namamana kung inyong tatay o nanay higit na, meron hong tinatawag na asthma. So meron na tayong predisposition sa ganong klaseng sakit. Meron hong mga pag-aaral na ginagawa na kung ang meron ho mga viral infection na nangyayari during nung tayo ay maliit o sanggol at maaring makapagbigay ng problema sa tinatawag nating pagpapaliit na daanan ng hangin.
So, yes, go ahead, Doctor.
Yes, that itself is how we develop asthma. So, dapat na pakatandaan natin na ang asthma is a genetic disease. So, hindi po yun totally nawawala sa atin. It's a misconception among people that it can be outgrown, but it's not correct. It's not correct. Minsan ho natutulog yan during at a certain age at only to come back at middle age.
So, the signs and symptoms of asthma, Doctor?
So, katulad ng nasabi kanina sa primer, lumiliit po yung daanan ng hangin. Pagka lumiliit ang daanan ng hangin, tayo ay nahihirapan. So, makikita natin ng ating mga pasyente o yung ating mga patients who are afflicted with such a disease, mabilis ang paghinga. That's one. And then mapapansin nyo kung sobrang liit, nangingitim ang labi at saka mga kuko.
Okay. So does one who have these symptoms necessarily have asthma, or pwedeng iba ang sakit nila but the same symptoms?
Well, you're quite correct. Quite correct. Meron kasi mga sakit na nakaka-simulate. It can simulate asthma. One of them, in fact, is pneumonia. It's a common disease. But yung manifestations na yon are not specific for asthma alone.
So if the manifestations are not specific for asthma alone, how does the doctor diagnose? How do you, as a pediatric pulmonologist, diagnose someone who has these symptoms and who has asthma?
Ang pinaka clinical manifestation na dapat malaman nating lahat would be the presence of wheezing. Ito yung madalas na sinasabi ng mga tao na meron silang naririnig na parang kuting sa kanilang likod o pumipito. Yun by itself ay manifestation ng asthma. Pero gusto ko lang liwanagin sa ating mga manonood na hindi ho lahat ng pumipito o nagwi-whistle o nagwi-wheeze dahil sa asthma. But karamihan po noon dahil sa asthma. So, yun ang siguro ang sign na talagang ang isang pasyente ay nagkakaroon ng acute attack of asthma from the layman's standpoint.
So you mentioned acute attack of asthma. So what exactly is an acute attack? Aside from the wheezing, yung, diba? Parang ganyan ba ang wheezing?
Well, yung ginawa mo would be, you're quite correct, yung sound kasi yun naririnig natin, but yun ay paloob. Ang asthma ay palabas. So yung palabas ay, yun ang asthma, hindi po paloob ang tunog. Of course, mandatory rin na masabi ko na yung karamihan ng mga pasyente na inaatake ng asthma should have cough. So dapat siya inuubo mas lalo sa gabi o madaling araw. Or kung ma-identify mo yung triggers, yun ang nagiging dahilan kung bakit sila nauubo. And then, pagkapapakinggan nyo sa likod, meron siyang pumipito.
Okay. So, at night and in the morning, normally, allergies attack in the morning and at night. Minsan po, hindi ba, doctor, like pollen, maybe you're allergic to pollen, and it happens in the morning or at night. So,
right.
may relation ba yan?
Well, in a sense, the answer is yes and no, actually. Ang dapat po nating tignan yung daanan ng hangin, hindi lang po yung isang tube na rigid. No, it's not. It's not correct. Natutulog din ho yan, quote-unquote, na pagdating sa gabi, lumiliit sila talagang sadya, at pagdating ng araw, lumalaki din. So, siya ay flexible na lumiliit at lumalaki. Ngayon, kung isipin natin na pagka ang daanan ng hangin ay sadyang maliit sa gabi, at talagang lumiliit na sadya, normally, ang ating airways, then ang ibig sabihin nun, lalong nagmamanifest sila sa gabi o madaling araw. It is not necessarily related sa pollen, but it may be associated with something inside the room. So, papaano po yan ang ibig sabihin? Kunyari, naka-carpet, your room is fully carpeted. Ano po, yung curtains, dahil merong dust, then that's the time you have this kind of a problem. Sila ang nagtitrigger ng asthma.
So, if you have asthma at you're exposed to all these elements that you mentioned, lalo siyang it will be on the rise, so to speak.
Well, yes. In a way, yes. The answer is yes. But it triggers it. You know, kung wala po itong triggers na yon, then naturally, yung asthma will not occur. The acute attack of asthma will not occur. There has to be a trigger for it to occur. So it may be external or internal stimulus. Ano ibig sabihin ng stimulus na internal? Pwede po kayong, kunyari, may mga asthmatics. And this is true among teenagers. Pagka, kunyari, kukuha ng exam, nadidepress sila, sobrang galit. May mga patients ho tayo na tuwing magkakaroon ho sila ng monthly period or pregnant sila, nakakapag-trigger ng acute attack of asthma. These are all internal stimuli or stimulus. This is in contrast to external stimulus. Meron kayong pollen, halimbawa, or dust, or yung mga pets, mas lalo yung mga sa aso o sa pusa, mga balahibo o mga feather, maari makapag-trigger ng acute attack of asthma. Meron din hong mga ibang sakit na maaring makapag-trigger ng asthma. Ang good example ho niyan pagka meron tayong what we call allergic rhinitis. Ang rhinitis is just a medical term. Ang ibig lang sabihin, may sipon ng isang tao. But that's the one triggering it is an allergic stimulus. Pagka meron tayong allergic rhinitis, may chance na magkaroon tayo ng acute attack of asthma. One of the more commonly reported internal, this is an internal stimulus that can trigger an acute attack of asthma is GERD or gastroesophageal reflux disease. So, ang ibig lang po sabihin nun, yung normally pag kumakain tayo, yung ating pagkain from sa tiyan, dumediretso sa bituka. But ito ho umaakyat. So, instead na siya ay dumediretso sa bituka, yung ating kinakain, umaakyat pabalik, pataas. At pagka yun po napunta sa ating part kung saan tayo humihinga, laryngeal area, papunta sa trachea, yung ating daanan ng hangin, it can trigger an acute attack of asthma.
These triggers that you mentioned, external and internal
stimuli, yes.
Stimuli are for those diagnosed with asthma already.
Yes.
But can you get asthma because of this external and internal stimuli
No.
na hindi ka naman na-diagnose before or hindi galing sa childhood?
Hindi po. There has to be a genetically susceptible individual before you can develop it. Ngayon, meron hong always, that's the general rule, but meron hong mga
Exception to the rule.
exception. Like, meron hong mga pag-aaral na ginawa na pagka nagkaroon ka ng viral infection ng ikaw maliit at mas lalo at severe, it can lead to an asthma-like disease or condition.
So if you're a child and you had bronchitis, pwede bang mag-develop into asthma in adulthood?
Right. You're quite correct. The bronchitis here is just inflammation of the bronchus or bronchi. And the inflammation can be attributed to a previous insult. And if you say this is a previous insult secondary to a viral infection, then you may have these manifestations compatible with asthma. Ang tawag ko namin doon is asthma phenotype. Asthma phenotype meaning to say yung presentation niya is like asthma. Meron din kasi mga sakit na nangyari, kunyari, premature. Yung premature na baby, of course, na lumabas, nakakuha siya ng oxygen, na hindi naman dapat yung lung niya na-damage, then it can lead to an asthma-like phenotype or clinical presentation.
And the classifications of asthma, mild, I understand there's mild, there's severe?
Dalawa po yung uri ng pagka-classify natin ng asthma. First is during an acute attack. Bakit kailangan po natin na ma-classify ang asthma in the first place? We need to classify this primarily for treatment purposes. Hindi lang sa doktor, kung hindi pati na rin sa ating mga pasyente. So, ang una nating titignan kung ang isang pasyente ay merong acute attack of asthma. During an acute episode, nahirapan mo siyang huminga, ang titignan lang kung mild, moderate, o severe. Bakit kailangan na ganoon na i-classify? Dahil kung moderate to severe, higit na kung severe, kailangan na po natin siyang dalhin sa ospital para makapagbigay ng appropriate treatment and oxygen. So, kailangan na niya mag-oxygen para supplement, yung kanyang condition. Yung isang classification naman, yung recurrences ng attack. So, ang ibig sabihin, kung siya ay paulit-ulit, ang magic number is 2 weeks. Kung siya ho ay paulit-ulit na nagkakaroon, every 2 weeks nagkakaroon ng problema. Higit na kung nakaka-impair siya ng 1, pagtulog, o pangalawa, ng daytime activities, then meron ho tayong karampatang kaukulang gamot na maaring maibigay. Ang tawag ho doon is persistent type of asthma. Every 2 weeks siyang nagkakaroon ng problema.
So, in every 2 weeks, kung nagkakaroon siya ng problema na ganyan, does he have to go or does she have to go to the hospital? Kailangan ba siyang bigyan ng oxygen
hindi
also?
naman,
Like
no.
yung acute?
No, hindi naman. But ang essence lang doon is you try to give medicines that will prevent recurrences of the attack. So that is basically the idea. And yun hong pagbigay ng medicine should come from a doctor because meron hong dalawang klase. Yung isa is inhaled steroids and the other one is Montelukast or leukotriene antagonist. These are 2 classes of drugs. And ang doktor ang siya magde-decide kung ano ho ang best for the individual.
And as a pediatric pulmonologist, we will talk about asthma in children.
Of course.
Doctor, all that and more when MedTalk returns.
Did you know that globally, 13 million children miss school every year because of asthma? In fact, 44% of those hospitalized due to asthma were children, according to allergyasthmazone.com.
We're back here on MedTalk, still talking about asthma. This time, doctor, we have a caller on the line, Miguel. Hi, Miguel. Good evening.
Hi. Curious lang kasi ako if it's possible for asthma to act into emphysema.
Miguel, good evening. Do I get it that you want to ask if asthma can lead to emphysema?
Yes,
Is that right? Well, emphysema is a different thing. Emphysema, if you're not talking of emphysema in adults, because we have also emphysema in pediatrics. Emphysema adults is part of this so-called COPD or chronic obstructive pulmonary disease. Right now, people are looking at, these are 2 different things actually. Emphysema means you have a distraction of the alveoli. Miguel, are you still here?
Yes.
Yes. So these are basically, these are analogous but not exactly the same disease. Yes.
Oh, okay.
Okay, so did Doc Kristen answer your question, Miguel? Any other questions?
Yeah, I've actually had asthma for a long time, pero possibly bigla na lang siyang nawawala for some reason in your adult life. Like when I was a child, I had it, pero when I became an adult, parang nawala siya.
Okay.
Well, not exactly. It's not correct because, asthma is a very interesting condition. It exists in silent and active form or acute form. This is basically a genetic disease. So, at a certain age, it's supposed to be, people are saying that you have outgrown it, but it's not entirely correct because if I get to test you, even if you don't have any symptoms, it will appear in that specific test that you still have asthma. But it really doesn't matter because
I don't have it anymore.
It really
pero
does.
Meron pa rin pala.
Yes, of course. But it really doesn't matter because you don't have any symptoms at all. But to us doctors, we can say that you still have asthma. There are certain tests that can be done to see if truly you have asthma or not.
Oh, is it as dangerous as, not having asthma?
You're asking if asthma is
Like,
dangerous?
since I don't get any symptoms anymore, is it as dangerous or no?
I'm sorry, I don't get the question, Miguel. You're
Like,
asking...
'cause I'm not getting any symptoms. I feel like I don't have asthma anymore, but you say that I do. Is it possible that even if I think I don't have asthma anymore, the attacks can be as dangerous as those with the symptoms?
Well, no. No, of course not. But you have to be very careful, of course. And one of the things that we are always tell our patients is, well, this is something, I hope you don't smoke, or you're not exposed to people who smoke. Because
I actually do.
Oh, hence the emphysema question, Miguel.
Right. Well, that's one thing that you have to look into. Well, smoking is bad for anybody, actually, so you have to stop that.
Yes.
Regardless whether you have asthma or not. But it can be a good trigger for asthma, though.
Oh.
Okay.
All right. Well, thank you very much.
You're welcome. Thank you too, Miguel. Take care.
All right. You guys take care too.
All right. Thank you. So, Doc, pediatric pulmonologist. Now,
Yes.
asthma in children. Miguel started it off by saying he had asthma as a child and then nawala.
That's correct.
So what happened? What happened there? How is asthma in kids, and why does it go
No,
away?
alam mo kasi parang ang tanong kasi diyan parang bakit nung maliit maraming buhok ang isang sanggol? I mean, konti ang buhok
Konti,
rather.
yes,
No?
yes.
Tapos habang lumalaki, kumakapal, tapos habang tumatanda, katulad ko nawawala ng buhok, something like that. No, it's supposed to be genetics. So meron naka-encode.
Yes.
You know, parang katulad din. A good example would be your tummy. You know, I was hearing you kanina, yung abs and everything.
Yes.
Pagka maliit siya, pagka maliit, medyo malaki yan siya nung bata. Habang lumalaki, pwedeng lumiliit. But habang yung nagiging tumatanda, lumalaki. Ganon din sa asthma. Meron nakasulat na sa genes natin na habang nare-release mo on certain age, people are fascinated. Bakit nawawala ang symptoms? And of course, maraming theories po dyan. Like, kunyari, nawawala ang triggers, nakokontrol. Yung tao siguro, namamanis nila yung asthma, kawala silang atake ng hika. Something like that. But personally, ang tingin ko, nakasulat yan sa genetic code. And then, sometime later, lalabas at lalabas.
So parang natutulog lang siya.
You can say that.
No?
Oh,
As
but
you
yung
get
concept,
older.
yun, ganon. But it's either natutulog or something is suppressing it.
So as a child, kunyari, parents sometimes, no, the slightest wheezing sound or cough, you'll think na may asthma yung anak mo. And then, lumaki na, you know, you get older, the child gets older, and you say, ay, nawala na yung asthma niya, but it was not really diagnosed.
Right. Nawala yung atake ng hika, but yung hika itself, nandun pa.
Bakit siya common childhood disease?
It's not exactly common. Well, ang pag-aaral yan is about 16% of the population. Hindi siya relatively common. Kaya lang, ang triggers kasi mas madalas na nangyayari during childhood, which is viral infection.
Yes.
So, kung siya merong viral infection na madalas na nangyayari sa childhood, yun ang madalas na nagtitrigger ng asthma. So, it's a common knowledge na pagka bata ka, may asthma ka, at nagkaroon ka ng viral infection, mas madali kang na-atake. But about 16%, I would say,
So
of the general population under 5.
So under 5...
Under 5 years old, about
yes.
16% would have this asthma phenotype.
And after 5 years old, it sleeps until it's triggered again.
No, it's common under 5. But habang lumalaki kasi yan, probably, maraming factors kasi yun.
Like what, doctor?
Nakokontrol yung environment. Pag nakontrol mo yung environment, you're not going to have attack of asthma. Like maraming nagsasabi, stop smoking, of course,
Yes.
pets, dogs and cats and
Yes.
things like that. Pag natanggal mo sa environment, bihira na silang na-atake ng hika.
Pero as children, they play. They play a lot. They may have pets. They exercise. They engage in so many different sports activities.
That's right.
Does it happen that nare-realize ng bata na may asthma na siya when he's faced with all these triggers?
Probably yes. But pwede ako mag-deviate a
Yes.
little bit about yung exercise-induced.
Yes, please.
Something like that. You know, I always tell my patients, kunyari ako, wala akong asthma. O sabihin mo na lang, wala akong atake ng asthma, may asthma ako,
Okay.
and I sit down, for 6 minutes, I'm going to hyperventilate. In other words, palagi akong hihinga ng mabilis. 6 minutes or beyond, in due time, magkakaroon ako ng atake ng hika, just by sitting down. Okay. Contrast this, kunyari ako nag-jogging, kunyari naglakad, etc. If may asthma ako, wala akong atake, tinahi ko yung aking bibig. Tinahi, kunyari lang. Hindi ako humihinga doon, hihinga ako sa ilong, hindi ako magkakaroon ng atake ng hika. So it's a common misconception, I think, na yung mismong physical exercise that's causing it.
Yes.
It's not exactly correct kasi pagka ikaw naglalakad o ikaw nagja-jogging, nagbibisikleta for instance, ang tendency mo kasi humihinga sa bibig. Any dry air, basta dry, any dry or cold air na pumampasok sa bibig, hindi sa ilong. Bakit? Importante kasi ang ilong dahil pagka pumasok ang air, nag-humidify siya and at the same time, naiinit. Na umiinit, dumadaan sa ilong. Pag sa bibig dumadaan at cold air siya, then yung cold air na yon, mas lalo pagka-dry, yun ang nagtitrigger ng acute attack of asthma. Hindi yung physical exercise. It's a misconception also that, bakit sinasabi, bakit swimming is best for somebody who's asthmatic?
It strengthens the lungs.
It's not correct. Because you cannot strengthen your lungs. You can strengthen the muscle that controls the physiology of respiration, but you can never strengthen the lung with swimming. Anong nangyayari niyan? Pag nagsuswim siya at hihinga siya, yung mismong pumapasok na air sa bibig, humidified. Kaya kahit ilang laps siya pumupunta o nag-aano siya, lumalagoy, hindi siya nagkakaroon. It's because of that. And people nami-misinterpret nila ngayon. Sasabihin nila, maganda yung exercise na yan, hindi hika. But dahil sa humidified air ang pumapasok, hindi nagkakaroon ng hika ang isang pasyente while swimming. This is true primarily sa dagat. Bakit? Kasi saline.
Yes.
But when people start going now to swimming pools, mas lalo pagka mataas ang chlorine, then they start having attacks of cough, that may eventually lead to an acute attack of asthma progress.
They might think that the swimming activity is the one that triggered it, when in fact, it's the high chlorine content. How is asthma diagnosed in children, doctor?
Well, let's start first with yung siguro yung older age group or adult per se. Meron kami tinatawag na spirometry. It's not really that complex. It's a small machine. Ang gagawin lang po doon hihinga, parang i-measure yung daanan ng hangin. It's just like, kunyari, sasabihin ko sa iyo, meron akong hypertension. Masakit yung aking ulo, hypertension. Halimbawa, tumataas ang blood pressure. Meron kang pangkuha. That's spigmo. Yung sa pulmonary side, meron kaming equivalent. Ito yung tinatawag naming spiro. So yun, mami-measure namin yung liit ng daanan ng hangin. At meron kaming ibibigay na gamot at kung siya ay luluwag, more than 12%, sasabihin namin may asthma ang bata. Ang problema lang sa ganung klaseng procedure, it requires cooperation on the part of the patient. So, meron na ngayon, katulad sa Philippine Children's Medical Center, Philippine Heart Center as well, meron kaming mga machine or makina na hindi kailangan na yung mismong pasyente ang may effort. Even just by placing yung mismong gadget, we can say that the patient is most likely asthmatic or not.
It's difficult also kasi for children to stay still. At a certain age, is that why there's an alternative way to diagnose
You're
asthma?
quite correct. But sometimes we do it at a time na siyempre yung bata is fully cooperative or natutulog. So it's a labor-intensive procedure that we're doing. But it can be done, and we're doing it actually.
So aside from clinical tests, family history, like you've mentioned earlier, is also very vital in the diagnosis
These
of
are
asthma.
Yes, you're quite correct. This is contributory to the diagnosis of asthma. But the gold standard, that's why we're saying it's the gold standard. Kasi ang mahirap minsan sa family history yung recall bias. Sasabihin nung tatay o nanay, hindi ho doktor, parang wala ho kaming ihika nung maliit o hindi namin matandaan. O sa sobrang liit nila, na-outgrow nila, hindi, or na-outgrow, that's quote unquote, then sasabihin nila, parang wala ho kaming ganyang klaseng sakit. So, we call it recall bias on the part of the parents. When in fact, ang totoo pala niyan, asthmatic na sila to start with.
So, pag ang parents asthmatic, talagang the
Malaki ang chance,
na ipapasa sa anak nila is...
Tama po kayo. Ang concern lang, hindi siya yung iba. Meron kasing mga genetic disease that you can predict accurately ilan ang magkakaroon o saan magkakaroon. Ito, it's familial. We cannot exactly predict kung sino sa mga anak ang magkakaroon o hindi.
So if you develop...
It's familial.
If you develop asthma in adulthood na wala kang asthma na na-diagnose when you were a child, and then you get married, you have children, is there still a possibility na you will pass that asthma on in adulthood already?
The answer is yes and no. Alam mo yan, I was telling you kanina, my specialty is basically pediatrics, and
yes.
probably the best person to address that concern is an adult pulmonologist. But I still think kung late
General.
onset and asthma, and strictly speaking, it's asthma,
Yes.
I think pwede siya maipasa niya yung genes sa kanyang mga anak.
So, doctor, we'll talk more about asthma. We'll talk, we have a case study who has been diagnosed with asthma and who's getting well when MedTalk returns. For Pachit Icasiano, asthma first reared its ugly head when he was 4 years old.
Hindi ako inalisan na asthma. Tapos ang asthma ko grabe, para akong mamamatay. Kasi nagagaspa ko lagi ng breath eh. Lagi ako yung parang kalak mo last breath ko na, mayat-mayan. Masakit ang dibdib ko, hindi ako makahinga, tapos hindi ako makatayo.
He came from a family of asthma sufferers. 2 of his relatives succumbing to death because of asthma. Due to his condition, his activities were limited.
Hindi ako naka-enjoy maglaro, hindi ako naka-enjoy sumama sa mga brothers ko, sa mga kapatid ko sa maglaro sa labas. Lagi lang ako naka-confine sa loob ng kasi yung mother ko napaka-protective. Ay, papawisan ka, uubuhin ka, ganyan.
Now at 50, Pachit has better understanding of the disease.
Meron ako immediate medication na bago pa lang ko atakihin, iniinom ko na siya. O tapos lahat ng mga yung sinasabi ng lola ko, inom ka maraming juice, tubig para hindi ka asthmahin. Yun, talaga hanggang ngayon ginagawa ko.
We're back here on MedTalk, still talking about asthma. You may join the discussion by calling our hotline at 548-4678. Doc Kristen, we have another caller on the line.
Yeah, please.
Sunny Faustino. Hi, Sunny. Good evening.
Hi, good evening, ma'am.
Yung question mo para kay Doc Kristan. Please go ahead.
Hi. Doc, tatanong ko lang po kasi may allergy asthma po ako. Ang problema ko po, kung kailan madaling araw, ako inaatake, lalo na pagka yung panahon na ng Fairmont. Hello?
Yeah, sige po, nakikinig po kami.
At saka po, Dok, pagka yung kunyari, minsan, yung nanonood po ako ng television na nakakatawa, yun, inaatake ko po. Ano po ang paikupan niyo sa akin?
Ganito po kasi yan. Ano po? Unahin muna natin yung bear mat na sinabi po ninyo, Mang Faustino. Tama po ba? O, yung pong bear mat, yun yung karaniwan na sinasabi ng mga tao, nagpapalit ng panahon. Ano po? Ang pagpapalit ho ng panahon ay associated yan with pollen. Basta lalo pagka tag-ulan, mas gusto ng mga pollen na lumalabas. Quote unquote. So yun po yung ating dapat tignan. Doon po sa inyong paligid, titignan natin kung ano po yung mga namumulaklak na puno o halaman. At yun po ang inyong titignan. Ang pinaka-best po niyan, kung meron kayong probinsya, o kayo matitirahan na medyo malayo sa inyong lugar, doon ho nyo makikita kung talagang doon sa halaman, kung may namumulaklak, o punong namumulaklak na nakapaligid sa inyo, ang dahilan kung bakit kayo inatake, pagdating ng bear months. So, yun po.
Bali, tiga-Haguni po ako eh. Probinsya po ng Haguni. Dito po kami nakatira ngayon.
Opo, hindi.
Dito kami nakatira.
Kung kami po iimbitahin nyo lahat dito sa inyo sa Hagonoy, makikita namin kung ano yung mga halaman. Pero ang titingnan po nyo sa paligid ng inyong tinitirahan sa Hagonoy, kung anong klaseng namumulaklak na halaman para malaman natin kung yun po ang nakaka-trigger ng inyong acute attack of asthma. Opo. Yung pong isang nasabi po ninyo at katulad yung nabanggit ko kanina, yung nabanggit ko po kanina, yun pong internal stimulus or stimuli. Pagka, kunyari po, ito ho yung nakikita namin, mas lalo sa mga teenager, pagka sila po nadidepressed dahil sa pag-aaral o ano paman, or sobrang pagtatawa, tama po kayo, maaari po kayong magkaroon ng acute attack of asthma. Mahirapan po tayo doon kasi siyempre ang ating solusyon dyan huwag kayong tatawa.
Mahirap naman yata yun, Doc.
But ganun po talaga. Meron ho talagang mga pasyente na pagka sumobra ang kanilang tawa, aatakihin ho sila ng hika. Tama po kayo.
Kasi po, Dok, sa aming magkakapatid, ako lang ang may hika. Kung kailan matanda na, saka pa nagkahika.
Tama po.
Actually, po ako yun.
Opo, tama po yun, tatay. Meron pong at an very young age nagkakaroon ng hika, at an adult age nagkakaroon din ho ng hika. Talaga pong malas lang na nagkaroon kayo ng atake during this time of your life.
Ay, ganun po ba? Baka na naman ang makalungkot.
Pero wag ko kayo malungkot kasi meron ho mga gamot na maaring maibigay sa inyo para ma-prevent ang recurrences ng hika.
Yung ginagamit ko po ngayon, yung ini-spray sa bibig. Hello po.
Sige po, ano pong gamot yung na hindi ko po nakuha?
Yung ini-spray po sa bibig, pagka inatake po ako. Hindi pa ako gumagamit ng nebulizer
Spray daw, Doc.
Spray.
Apo.
Ang nakalagay po doon sa spray, tatay, ano po ito? Salbutamol?
Apo.
Tama po kayo. Ang salbutamol po, pampaluwag ng daanan ng hangin. May dalawa pong general na paraan para tayo po makapasok yung gamot sa ating sistema. Ang una oral. Ano po? So ito po tableta o sa bata syrup. Tama po. Tapos doon po sa may makakaya na nila o nahihirapan na silang huminga, kailangan natin ng fast relief. Ito po yung sa either nebulizer or inhaler.
Apo. Ang napapansin ko naman po ngayon sa madaling araw, talaga, hatching ako ng hatching.
Opo. Tatay,
Pwede rin po ba yun?
Opo. Tatay, pagka sinabi po kasi yung palagi kayo nag-i-sneeze, ang isang...
Madaling araw, Dok.
Tama po kayo. Pagdating ho na madaling araw at madali kayong nag-i-sneeze, ang ibig lang po sabihin, meron po kayong naamoy sa environment during that time. Say about 11, 12, up to early morning. Meron ho kayong naamoy, kaya ang katawan ho natin, gusto nilang sasabihin sa inyo, parang may naamoy kang hindi maganda, kailangan mo ilabas, so you sneeze. Unfortunately, pagka yun hong naamoy na yan, hindi ho natin nailabas through sneezing, yan ho pumapasok sa daanan ng hangin, windpipe or trachea, at magkakaroon na po kayo ng atake ng hika.
Kasi po, minsan lang. Minsan po kasi nakakalungkot. Minsan 10 times, 12 times.
Okay, Sunny.
Ay po.
Oo. Salamat sa pagtawag at saka take care. Salamat, Doc. Any last message? Just a quick last message for Sunny. Okay, maraming salamat, Sunny, sa pagtawag. Morning and evening asthma attacks, that is what we were trying to understand and explain earlier.
Right.
And the presence of pollen in your environment.
Or presence of triggers in general, not necessarily pollen. But
Just triggers in general.
Right.
Doctor, we had our case study, Pachit, who was diagnosed with asthma at 4. Couldn't play, couldn't enjoy his childhood because his mom would be so cautious in maybe sending him out to play with his brothers and sisters. And then at 50, he's much better with all the medications that around him.
Right. So alam mo, well, one of the things that we tend to forget, meron namamatay dahil sa atake ng hika. That's one. Very certain. I have witnessed a lot of patients. In fact, some of my patients, unfortunately, they die. Talagang dati ko nang tinitignan, properly controlled, then all of a sudden, they come sa emergency room. Sasabihin nila, hindi makahinga. And I've witnessed some, talagang namamatay sila right before my eyes. So, asthma can kill. Bakit? Kasi sobra ang liit ng daanan ng hangin.
Paano nangyayaring biglang lumiliit yung daanan that small, that can lead to death?
Well, wala nang papasok na hangin. Ang pagliit ng daanan ng hangin is not an all or none phenomenon. Hindi po. So, hindi yan yung konting liit o dapat nating isipin, pwedeng konti ang liit, pwedeng sobra ang liit. Pagka sobra ang liit, wala nang papasok na hangin. That's the reason why kailangan madala kaagad siya sa nearest medical facility para ma-assess correctly kung kailangan niya magbigay ng oxygen or not.
Okay.
And that's
Doctor,
one.
thank you, Doc Kristen.
Right.
Sorry to cut you there, but we have
Sure.
another caller on the line. Good evening, Florante Cruz.
Yes, good evening, ma'am.
Go ahead, yung tanong mo para kay Doc Kristen.
Okay, Doc. So nasa ibang bansa pala ako, inaatake po ako talaga ng asthma na yung mahirapan akong huminga. Nung nandito ako sa Pilipinas, parang nagbago siya. Yung hindi na ako nawawalang gaano ng sipon laging meron po. Tapos pag nakaamoy ako ng matapang na amoy, lalong nag-trigger yung clogging ng nose ko. Nasa rate po ba ng asthma po rin po yan?
Hindi ko pa nakuha yung huling katanungan po. Pakiulit lang po, Mr. Cruz, kung ano po yung huling tanong.
Yung sa Pilipinas na po ako, yung pag nakakaamoy ako ng matapang na amoy, hindi na ako nawawalan ng sipon. Yun bang sipon na to, line po ba sa asthma rin po ba ito?
Opo. Okay. Ganito po kasi ang pananaw ng karamihan mga doktor. Meron nung kaming tinatawag na, ito po ay konsepto na tawag namin ay United Airway.
Opo.
Ang ibig po sabihin, yung United Airway, kung ano yung nasa taas yung ilong, at ang anong nasa baba, ito ho yung ating daanan papunta sa baga, halos magkakapareho. In other words, kung ano po yung nagtitrigger papasok sa ilong, maaari ding siya makatrigger ng acute attack of asthma. Tama po kayo na pagka meron nung naamoy kayo matapang, magkakaroon kayo ng sipon. At kung yan po nakalagpas papunta sa daanan ng hangin, siguradong kayo atakihin ng hika.
Mm-hmm. So ano po yung the best po na solution po o kaya yung para ma-prevent po?
Ang una po natin talagang dapat tignan kung ano po yung nakaka-trigger. Alam po ninyo, makukuha nyo yun just by astute observation. Ano ho ba yung nasa environment nyo, nasa tingin nyo, or activities na inyong ginagawa na maaring mag-trigger. Yun lang po kasi pagka yun po inyo correctly ma-identify, then pwede nating iwasan and therefore hindi kayo magkakaganyan. Ngayon kung medyo mahirap po yun na magawa o mahirap nating matukoy exactly kung ano yung nagtitrigger at sa tingin nyo allergic in nature ang inyong triggers, that you can go to an allergologist and the allergologist will do some tests to determine exactly kung saan po kayo allergic sa isang tinatawag nating aeroallergen. May naamoy kayong kontra sa inyo, i-identify niya correctly by using skin test.
Okay. So, okay na, Florante?
Okay na po. Thank you po.
Maraming salamat din. Thank you for calling. Okay. Doctor will talk more about asthma, learning to manage the symptoms of asthma when MedTalk returns.
According to allergyasthmazone.com, roughly 400,000 to 1 million children with asthma have their condition worsened because of exposure to secondhand smoke.
We're back here on MedTalk, still talking about asthma. Dr. Kristen, to wrap up our case study, Panchit,
Right.
you would like to add something?
Yes. Yun nasabi ko kanina sa iyo, no, that it can kill. Talagang may namamatay dahil sa attack ng asthma. Pero hindi rin ibig sabihin that it should control us, our daily activities. Naawa din ako doon sa mother na medyo kabado. Yung sinabi mo kanina, ayaw niyang palaruin. Ang hindi dapat, kasi alam mo, ang role ng mga doctors kami, is to make sure that yung mismong pasyente can lead a normal life.
Yes.
Yung daily activities niya, pwede siyang pumunta sa school, walang school absenteeism, pwede siyang mag-engage ng sports. That is our problem. Leave that to us. No? So yun ang aming magiging concern. Hindi excuse ang asthma na sasabihin natin yung isang bata malilimit sa kanyang daily activities. So yun din ang gusto kong iparating on another point. Although it can be fatal, it can be managed great. Ang ibig sabihin, hindi siya dapat ikatakot na yung bata, ilalagay mo, ikukup up sa isang
bubble.
room,
Yes.
sa isang inside the bubble, you're right. Sasabihin mo, huwag kang gagalaw, bawat ganun, etc. Hindi po dapat na gano'n.
Okay, Doc. Thank you for reminding
Yes.
the parents out there. Maraming
Right.
pong salamat. We have another caller on the line, Leah de Guzman. Hi, Leah. Good evening.
Hi, good evening.
Please go ahead with your question for Doc Cristan.
Actually, it's for my husband. He's had asthma since he was 7 years old. And the last time he had a checkup was when he was still in college. So he'd like to know if he should still take Ventolin and Symbicort because those are the two drugs that he's taking.
Okay. Good evening, Dr.
Yes,
Cabanilla
good
po.
evening.
Now, first of all, let me clarify this. Ako po ay isang pediatric pulmonologist. I'm not an adult pulmonologist. But I can answer your
Okay.
concern, actually. Now, it's okay?
Yes, sir.
Okay,
Please
there
go
are two
ahead.
types of medicine po in asthma. Two general types of medicine. If you're having an acute attack of asthma, is Leia still in?
I'm sure she's watching at home, Doctor.
Kung meron kang acute attack of asthma, then you make use of a bronchodilator. Gusto mo ma-dilate yung areas, gusto mong lumuwag ang daanan ng hangin. And salbutamol is just but one drug. So maraming brands yon, but salbutamol is just but one generic drug. Tapos, pwede mo rin dagdagan ng prednisone just to decrease the inflammation. But these are two things or two classes of drugs that you can give during an acute attack. So, iba naman po yung Symbicort. Yung Symbicort ito yung prevention ng recurrences ng attack. So, meron ho akong atake ngayon ng asthma. Kailangan kong kumuha ng salbutamol. Salbutamol is generic for certain brands. Pagka ako ay nakakuha na ng salbutamol, luluwag yung daanan ng aking hangin, ng daanan ng hangin at sasabihin, ayaw ko nang magkakaroon ng atake ng hika. So, pupunta na naman tayo sa ibang klase ng drugs. Yung isang klase ng drug na sinasabi ko, dalawa hatiin nyo yun. Isang Montelukast at isa pong inhaled steroids. Yun hong minention nyo is a brand of an inhaled steroids. Yun ho ay binibigay para ma-prevent ang recurrences ng attack. Now, ang tanong ho kanina ni
Leah.
Miss Leia,
Yes.
kung kailangan pa niyang kumuha. Kung siya ho yung inyong husband meron ho acute attack of asthma, then dapat ho siyang kumuha ng bronchodilator or ng salbutamol. Pagka ho palaging hinihika siya, palaging inaatake ng hika, then you start giving your inhaled steroids, yung minention ho ninyong brand.
Okay.
I hope I answered her question.
I hope so too. Thank you, Leah, for calling and for watching. Okay, Doctor, you mentioned these medicines, no,
Yes,
that are a matter of concern for Leah's husband kung kailangan ng itigil ang mga gamot because he was diagnosed 7 years old, di ba?
Right.
And when you're diagnosed at 7 and you go through life knowing that you have asthma, is there a period in your life na kunyari every 6 months you have to kailangan magpa-check up even if you don't have an attack? Is
Hindi
that
naman, no,
is
hindi
that
naman.
best to do?
No, of course not. Except if you're taking those maintenance medicine, then you have to have a regular checkup. Usually, a minimum number of months naman yan is 3 months. You can take it out at the 3rd month and beyond.
Okay.
So, pagka natanggal mo na, then you quote-unquote, unfortunately, you have to wait for the next attack. Kung medyo matagal na, more than 2 weeks, months, and years, you don't have to take a maintenance drug for that.
Is there such a thing as becoming immune to the drug that you take?
When we say immune, you're saying that it's tolerance.
Yes.
That's what we call it, tolerance.
Okay.
Hindi naman, not exactly correct. Wala pong tolerance on that, along that line.
Now let's talk about managing the symptoms of asthma. How does a patient learn how to manage these symptoms?
Alam mo yung isang pamamaraan ng paggagamot ngayon, mas lalo sa ating mga pasyenteng nakikinig, tinuturuan na ho namin, meron kaming tinatawag na asthma diary.
Okay.
Yun itinuturo na namin sa kanya na pagka ito na ang unang simptomas ng hika, meron na po dapat gamot na kunin para ma-relieve na siya. Tapos kung siya po nagkakaroon ng recurrences ng attack ng asthma, ito na ang dapat na gamot na ibigay. At periodically, meron ho siyang tinitignan kung siya ay nagre-respond or not. So, merong we call it symbiotic relationship. Merong we are empowering already our patients to manage their asthma, but kailangan merong guide palagi coming from the doctors.
So with that diary, that asthma diary, they can refer back to the doctors as to when the attack happened, what type of medicine they took.
Alam mo, meron nga mga key points din na even without consulting a doctor, meron nang nakalagay doon. Kung yung peak flow mo ma-reach yung certain level, then it's time for you to take an acute attack of asthma. Ang mahirap lang sa Filipino patients, this I can say, Filipino patients, minsan sila nang nagiging gumagamot sa sarili na.
Self-medication.
Ang self-medication is, I think, a big problem among Filipino patients. Minsan kasi na-over nila or na-under-treat nila yung sakit. Kasi nasasanay na sila, ito naman sasabihin ng doktor, ito ibibigay. Minsan, nasosobrahan. Nagkakaroon ka rin na ng adverse effect. Minsan naman na-under-treat nila, yun na naman nagiging problema. So, I still think periodically, meron talagang consultations with your doctor. But meron na kaming way by which we will empower our patients to manage their asthma. Yes. Whether an acute attack or recurrences ng attack.
Is this diary you mentioned coming from the pulmonologist or the patient has to make it on it?
May preset na. Any doctor, meron sila, aware sila na may asthma diary na pwedeng ibigay sa isang pasyente. But it's not distinct to pediatric pulmonologists or adult pulmonologists. Yung physicians, general physicians, they have it.
How about herbal remedies, doctor? What do you think of that when it comes to controlling and managing asthma?
Well, ang problem always ng herbal is anecdotal. Yun kasi ang minsan nagiging problem. Anecdotal means, meron akong asthma, kumuha ako ng certain medicine, gumaling ako, ergo, sasabihin ko effective yan sa lahat ng asthmatics, which is not correct. So, merong ginagawang pagsusuri o pag-aaral para masabi mo na yung gamot na yon, na herbal na yon, true for all asthmatics. It may be true to you, but it may not be true to all asthmatics. Yun ang mahirap sa herbal. So, sa aming pananaw, particularly sa aking pananaw, mas mabuti siguro kung we stick with yung usual conventional medicines that we're giving.
Diyan din pumapasok, doctor, yung self-medication. Kasi you're trying different
combinations.
Or if it works for you, not necessarily it will work for the next patient.
Yes.
Any other final message, doctor, for all our viewers out there on how to understand asthma, how to manage it, and how to control it?
Well, yun nga lang siguro, ang point is, asthma can kill, it can be fatal, but it can be managed accordingly. Yun lang po siguro ang gusto kong sabihin sa ating mga viewers.
And thank you very much, doctor, for helping us understand it. It's a very... you said it was very interesting, no? Asthma is very interesting, and yung habang nag-uusap tayo, we learned so much about it, na the triggers, the allergies, how to manage, how to control, and how to understand it, most importantly.
I certainly hope so.
Maraming pong salamat,
Maraming
Dr.
salamat
Crisan.
din po
See you
for this
again.
opportunity.
Thank you, doctor. See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. I'm Angel Jacob. Good night.
Meron hong mga pag-aaral na ginagawa na kung meron hong mga viral infection na nangyayari during nung tayo ay maliit o sanggol at maaring makapagbigay ng problema sa tinatawag nating pagpapaliit na daanan ng hangin.
So, yes, go ahead, doctor.
Yes, that itself is how we develop asthma. So, dapat na pakatandaan natin na ang asthma is a genetic disease. So, hindi po yun totally nawawala sa atin. It's a misconception among people that it can be outgrown, but it's not correct. It's not correct. Minsan ho, natutulog yan during at a certain age at only to come back at middle age.
So, the signs and symptoms of asthma,
Opo.
doctor?
So, katulad ng nasabi kanina sa primer, lumiliit po yung daanan ng hangin. Pagka lumiliit ang daanan ng hangin, tayo ay nahihirapan. So, makikita natin ng ating mga pasyente o yung ating mga patients who are afflicted with such a disease, mabilis ang paghinga. That's one. And then, mapapansin nyo kung sobrang liit, nangingitim ang labi at saka mga kuko.
Okay. So does one who have these symptoms necessarily have asthma, or pwedeng iba ang sakit nila but the same symptoms?
Well, you're quite correct. Quite correct. Meron kasi mga sakit na nakaka-simulate. It can simulate asthma. One of them, in fact, is pneumonia. It's a common disease. But yung manifestations na yon are not specific for...
It's not always apparent on what causes asthma to occur. The most common trigger usually comes from physical activities, or what is referred to as exercise-induced asthma.
And also it can be triggered by food. The most common are seafoods. So especially shrimp, crabs, eggs can trigger, especially the white of the egg, peanuts. And then the skin of the chicken can trigger asthma. Chocolates, cold temperatures, cold drinks can trigger processed foods, house dust mites. So these are the different triggers that can push a patient into developing an asthmatic attack.
If not treated, asthma can permanently narrow the airways and can easily translate to exposed nerve endings that will later on be even more susceptible to asthma triggers. What should you do when asthma attacks? What are some possible triggers and how can you avoid them? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Kristan Cabanilla, a pediatric pulmonologist from the Philippine Children's Medical Center and a fellow of the Pediatric Society and the Philippine Academy of Pediatric Pulmonologists. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Kristan.
Good evening. Magandang gabi po sa inyong lahat.
Welcome to MedTalk.
Salamat po. It's my pleasure.
And it's our pleasure to learn more about asthma from you, doctor. So what is asthma and what causes asthma?
Well, ang asthma po ay isang napaka-interesting disease by itself. Katulad doon ng sabi sa primer, lumiliit po yung daanan ng hangin, kaya nahihirapang pumasok at lumabas yung hangin. It is as simple as that. But ang concern lang ho minsan ho nagkakaroon ng triggers na pagka sobra ang liit ng daanan ng hangin, o nahihirapan tayong ipasok yung daanan ng hangin, talagang nahihirapang huminga ang isang tao, bata o matanda.
So pag nahihirapan huminga ang isang tao, it hampers their life, no?
Siyempre
their health,
po.
di ba?
Kasi yung oxygen, nahihirapan pumasok. Oxygen is quite vital. Day-to-day life natin, siya ho kailangan ng isang tao. So kung konti ang oxygen na pumapasok, at meron hong byproduct ng metabolism na tinatawag nating carbon dioxide. At kung hindi ho yun makalabas sa ating sistema, malalason ho tayo. That in itself, in a nutshell, is asthma.
And how does one develop asthma? What are the signs of one who has asthma or has developed asthma?
Ang pananaw ho ngayon, ang asthma is basically a genetic disease. Ito ho namamana kung inyong tatay o nanay higit na, meron hong tinatawag na asthma. So meron na tayong predisposition sa ganung klaseng sakit. Or asthma alone.
So if the manifestations are not specific for asthma alone, how does the doctor diagnose? How do you as a pediatric pulmonologist diagnose someone who has these symptoms and who has asthma?
Ang pinaka clinical manifestation na dapat malaman nating lahat would be the presence of wheezing. Ito yung madalas na sinasabi ng mga tao na meron silang naririnig na parang kuting sa kanilang likod o pumipito. Yun by itself ay manifestation ng asthma. Pero gusto ko lang liwanagin sa ating mga manonood na hindi ho lahat ng pumipito o nagwi-whistle o nagwi-whiz dahil sa asthma. But karamihan po noon dahil sa asthma.
So,
yun ang pinaka-siguro, ang pinaka sign na talagang ang isang pasyente ay nagkakaroon ng acute attack of asthma from the layman's standpoint.
So you mentioned acute attack of asthma. So what exactly is an acute attack? Aside from the wheezing, yung, diba? Parang ganyan ba ang wheezing?
Well,
Ang sound
yung
ng
ginawa mo would be, you're quite correct, yung sound kasi yun naririnig natin, but yun ay paloob. Ang asthma ay palabas. So yung palabas ay, yun ang asthma, hindi po paloob ang tunog. Of course, mandatory rin na masabi ko na yung karamihan ng mga pasyente na inaatake ng asthma should have cough. So dapat siya ay inuubo mas lalo sa gabi o madaling araw. Or kung may
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Asthma affects roughly 10.7 million Filipinos.
Well, if you look at the incidence of asthma, worldwide we have more than 230 million patients of asthma all over the world. And it's a common cause of hospitalizations, not only in children but also in adults. It's the third leading cause of hospitalizations worldwide, even here in the Philippines. Asthma is basically it's an inflammation of the airways. What happens is that there's bronchial reactivity, meaning yung daanan ng hangin mabilis lumiit, malikot siya, and at the same time it produces lots of phlegm.
While it